It looks like something out of MASH. A rocky, windswept field here on the edge of the Port-au-Prince airport turned into a tented medical center.
We're the largest hospital in Haiti, right here in a dirt field. It's really, really amazing.
Especially considering the rough conditions, constant air traffic, and UN troops headquartered next door.
82nd Airborne told me that they had just rotated out of Afghanistan and had told me that this was every bit as bad as Afghanistan and Iraq, just without the bullets flying.
This field hospital was set up immediately after the earthquake by the University of Miami and the medical nonprofit Project Metashare. Chief Operating Officer Tom Caloris runs it with hundreds of volunteers who rotate in from the U.S.
We have 3 general ORs, recovery, the first ever neonatal intensive care unit and pediatric intensive care unit ever in the history of Haiti. We've got radiology, lab, pharmacy, and a medical supply warehouse that most hospitals in the States would die to have, although it's in a dirt field in a tent.
We're here the same week as more than 40 medical volunteers from the Bay Area, including Sherry Bear, a trauma nurse from San Francisco General Hospital.
We're doing some pretty amazing things here under these conditions. I mean, we're standing on gravel, we're intubating patients, we're putting chest tubes in, people are going to the operating room, and we're saving people's lives.
Not that the Bay Area doctors and nurses don't find Haiti overwhelming.
It's very, very sad and devastating.
I've never seen anything this devastating. You know, entire buildings are pancaked, roads are completely impassable, people are living on the streets, and the tent cities are unimaginable.
But Bear and fellow San Francisco General Nurse Jamie Dwyer do find precious moments of beauty amid the sorrow.
There's a little girl in the pediatric ward that's kind of touched me. She has a below-the-knee amputation in one leg and a deformed foot in the other, and she's cruising around in her walker and always with a huge smile on her face. I love her.
Emergency room Dr. Malini Singh, also from San Francisco, says the crisis has brought out the best in the volunteers.
What's amazing is how a group of people who don't know each other can come together and make something amazing happen. We help take care of people in the best way we can. It creates miracles.
But also sometimes heartbreak, as we'll hear in our next report. In Port-au-Prince, Doug Sovern, KCBS. The University of Miami Project Metashare Field Hospital in Port-au-Prince has transitioned from desperately saving people pulled from the rubble to serving as a general hospital. Among those volunteering here, ER nurse Jamie Dwyer from San Francisco General and UCSF emergency room Dr. Chris Fee.
It's a lot of primary care follow-ups, a lot of fever, febrile kids. We're seeing some malaria cases.
We're working at 97-degree temperature outside. In these tents, it's probably 100 plus. Some days you have the medicines you're looking for, some days you don't. Depends on what when the supplies show up. And this is probably the best functioning hospital in all of Port-au-Prince right now.
Osma Pierre brings in her son Richard, whose hand was crushed in the quake.
This hospital is very good. So doctors behave well to the patient, so they give food to them, so everything is fine.
Not everything. Too often the patients can't be saved.
We just lost 2 babies that we didn't have to lose. We had Boston ready to take 2 of our burn babies because the paperwork took so long. So the one just died an hour ago. So that's the hard thing for those of us who
Kathleen Rossi McLaughlin, a nurse from Delaware, is overcome with emotion.
It's the kids. It's the kids. It's the kids. Just slams it home.
A grieving father's wail of sorrow pierces the ICU after his 12-year-old daughter's death.
The saddest thing is, you could save these kids in the States, and we're not in the States, we're in Haiti. And so you do the best you can. So you have to make a lot of ethical decisions that are very tough. I've been a nurse for 39 years. This has changed me permanently.
Malini Singh, an ER doc from UC San Francisco, says she's never had such an intense experience.
We've seen a lot of death, a lot of loss, but we've seen a lot of great things happen too, and it's balanced it out. The overall picture is this is like a true reflection of what life is like. It's like life compacted in 7-8 days.
Haitians are still dying because of the way they're living since the earthquake, as we'll see in part 3 of our series. In Port-au-Prince, Doug Sovern, KCBS. The shattered streets of Port-au-Prince teem with refugees from Port-au-Prince.
This is the central area of Port-au-Prince, so as you could see, it's pretty much gone.
Gabrielle Dennis takes us through the ruins of her hometown.
All the nuns that used to be in that school, they died.
Her church, her school, her neighborhood, all in the past tense.
It hurts. It hurts because there's nothing left that I could show to anyone.
It's worse than I expected. I was expecting horrific sights, and it was worse than I thought. I mean, buildings and rubble collapsed everywhere. Streets are covered in rubble.
Sherry Bear, a San Francisco General Hospital nurse volunteering here, is stunned by the tent cities that seem to fill every open space.
People have cardboard and sheets and maybe a tarp, maybe a sheet just surrounding them. And it's thousands and thousands and thousands of tents. Disease is going to spread and it's going to get ugly.
Rainy season has already begun. UCSF Dr. Chris Fee says these post-quake living conditions are why the field hospital, where the San Francisco team volunteers, is so busy.
You tell me if that's humane or not. People are living in, some of them cardboard, some of them these tarps. In a couple weeks, that's going to be all flooded. There's round 2 of the disaster.
This Haitian woman tells us in Creole the conditions are killing her people. David is her son.
Me and my mom, all my family, we sleep on the street.
How many are in your family?
Maybe we are 10.
10 of you under a tarp with some 2x4s?
Yes, sir.
But he's grateful to be alive and says he's better off than many.
Come with me, I show you whose people we need more help.
He shows us families with no water, no food, no protection from the wind and the rain. Survivors shovel away rubble that no government agencies ever come to clear. When they find human remains, they carefully set them aside.
This is where a lot of people had their lives. There's nothing left. But life goes on, as you could see also. People are setting up on the street. Things are opening up. So there must be hope.
And there is, as we'll hear in our next report. In Port-au-Prince, Doug Sovern, KCBS. Haitian women stir vast kettles of rice and beans in the rectory kitchen at St. Clair's Church in Port-au-Prince. Outside, more than 2,000 people, mostly children, line up for a precious plate, their only hot meal of the day.
Mostly there is nothing at home to eat. At least they can eat something here. You can tell some of them finish eat and taking something at home for the parents and other family at home.
Lavarice Gordon runs the food program, which is funded by the What If Foundation, started by Margaret Trost of Berkeley. Gordon says these kids were desperately hungry even before the earthquake shattered their country, leaving them homeless or orphaned.
We really need some hand from other people to assist, especially the population here.
A few miles away at the Project Medishare Field Hospital, that helping hand belongs to nurse anesthetist Janice Drake of Trussville, Alabama. She is one of the volunteers working alongside a team from UC San Francisco and San Francisco General. A few weeks before coming to Haiti, the 66-year-old Drake broke her foot in 3 places, so she hobbles around the OR in an orthopedic boot.
I had a lot of people say, "Are you sure you want to go? Why are you going?"
They asked that even more intensely as she was packing for this volunteer mission.
The day before I was to leave, I found out that I have breast cancer. The extent of it, we're not sure yet, but surgery's already planned.
After 38 years in medicine, Drake decided she needed to still come to Haiti to feel fulfilled.
This is one thing I knew I wanted to do in my lifetime.
Like the Haitians she is treating, Drake has no idea what her future holds or if she'll even have one. But she knows it will be better for having made this journey.
You cannot come to a place like this and it not change you in some way. I don't know the outcome, but I'm going to try to deal with that when I get home and do whatever has to be done.
We'll look at what lies ahead for Haiti in our next report. In Port-au-Prince, Doug Sovern, KCBS. It was an intense week.
4 big tents, the supply tents
in difficult conditions.
Don't drink the water in the showers.
Long hours, searing heat, raw emotions. Tom Caloris, who runs the Project Medishare Field Hospital, says the San Francisco team made a real difference.
There's literally been some miracles happen here.
UCSF Dr. Malini Singh says it was a terrific bonding experience for her group from the San Francisco General ER.
Together as a team, it's amazing what you can do to change the world.
Dr. Chris Fee from the UCSF ER realizes how blessed we are and how much we take for granted in America.
I've never done anything like this, and it's been very eye-opening.
But he leaves Haiti with mixed feelings.
I'm really glad I came. I really do feel like I've helped individuals and helped alleviate some pain and some suffering, but I'd be completely fooling myself, as would anybody else here, if they think that they're really contributing to fixing the big problem here. The big issues that exist here are so much beyond any of us that anything we think we're doing from a big picture standpoint is a Band-Aid.
There's still not enough medicine or food or even simple shelter for the earthquake survivors, says San Francisco nurse Sherry Bear.
The conditions here once we leave are kind of grim. I mean, really grim.
But Gabrielle Dennis, born and raised in Port-au-Prince, says Haitians never give up hope.
We have pretty strong will, and we've been through a lot. The country has been through a lot, and I think we're going to get up and make things work.
Tom Caloris believes that. He's moving the Medishare Hospital from a muddy airport field to a permanent building because the tents won't survive the rainy season. He remains in awe of how Haitians keep their faith even after a disaster this severe.
The pain that's just under the surface, they keep putting one foot in front of the next every single day. It's really amazing. The American people could learn a lot with the resolve and the resiliency of the Haitian people.
Gabrielle Dennis is deeply grateful for the life-saving work of these American volunteers. They will help bring Haiti's renaissance, she says, although echoing Martin Luther King Jr., she admits it will take years.
We'll get there someday. It may not be on my time. I may not be able to see it, but we'll get there.
In Port-au-Prince, Doug Sovern, KCBS.